Hey there, and once again, thanks for tuning in to my video series on abdominal pain and evaluation of that in the emergency room. And this is actually going to be part 3. And if you've not seen part 1 or part 2, they will be links at the end of this video. So please hang around to the end, learn this information, and then click on those links and go back and watch part 1 and part 2. This video, I'm going to remind you of the quadrants of the abdomen really quickly, and then I'm going to zero in on the right lower quadrant and discuss some of the things that can be going on there to cause pain on the right lower aspect or the right lower quadrant of your abdomen. And I'm going to briefly on some of them discuss some of the possible treatments on there, but ultimately what I like to do is just give you an idea of what could be causing your discomfort and then defer any kind of treatment or anything to a provider who is actually there with you if you're having discomfort in this area. Once they find out what's going on with you, then they can come up with a treatment plan for you and cover that with you. Now, very briefly, my name is Andre Huey. I'm a physician assistant and I work in the emergency room taking care of patients. And abdominal pain is a very common thing that I see in the emergency room and take care of. So I think it's very important to cover this and give people a really good understanding up front of what are some of the conditions that can cause abdominal discomfort in certain areas of your abdomen. And this is by no means an all-inclusive list of things, but it's conditions that I have taken care of and seen over many years of working in the emergency room, taking care of patients. If you will, really quickly, subscribe to my channel. That would really help me out a lot and I would truly appreciate it. And let's jump right into the information. To review very quickly, the abdomen, when we examine someone's abdomen in the emergency room, or really your doctor in your doctor's office or urgent care would do this as well. They look at your abdomen and there's an imaginary line that we use, 2 of them actually, to divide someone's abdomen into 4 quadrants. The first one is one that goes from left to right across the abdomen through the belly button or the umbilicus, and it divides the abdomen into an upper abdomen and then a lower abdomen. And then there's a perpendicular line that really starts just below the sternum in the center, going down. It goes through the umbilicus and further south, I should say. And it causes a perpendicular intersection like this at the umbilicus, and that creates, as you can see, 4 different quadrants. And today I'm going to be talking about the right lower quadrant and what are some of the conditions that can be caused in that area. Another thing really quickly I reviewed on part 2 video is that there are numerous conditions that can in general cause someone to hurt anywhere in their abdomen. Men and women, there could be 20 things. In addition to that, in women, there are several other conditions that can cause pain, anywhere from 24 to 26 things, depending on whether you're pregnant or not. So just to give you an idea of how complex it can be tracking down someone's reasons for having abdominal discomfort. But for this video, to keep it simple, we're going to jump right to the right lower quadrant of the abdomen, referring back to the quadrants that I just showed you, and discuss what could be causing discomfort for you in those areas and what I would consider if you came to see me in the emergency room as a patient. So the first thing, obviously, and it's the one thing that people think the most of, is an appendicitis. The appendix is a small little tubular projection off of the part of the large intestine in the right side of the abdomen. And typically that pain is in the right lower quadrant. Sometimes it'll start around your belly button or just under it, and it can occur over to your right in the right lower quadrant. And when that is found, and it's found basically through, or definitively through, a CT scan. But people typically have certain types of pain in that area. And we also look at your blood work, although You don't necessarily have to have an elevated white blood cell count to have an infected or inflamed appendix. But as a medical provider, we look at all of those issues, the history, the blood work, and your physical exam along with the CT scan. And then once we identify an appendicitis, then we call the surgeon because they have to evaluate you and do surgery to take it out. The next thing that can cause pain in that area is constipation. Now, I talked about constipation on my other video, but really that can cause you to hurt anywhere in your abdomen, but definitely also in your right lower quadrant. You tend to hurt more so in your lower abdomen when you're constipated and you're cramping. And basically what that means is that you just need to poop more. So your provider, whoever determines that's what your problem is going to be, they're going to come up with a treatment plan for you and give you recommendations on what to do, which is increase your fruits and vegetables, fiber, water intake, your activity. Depending on how severe it is, they may recommend some medications, either over-the-counter medications, sometimes prescription medications. And if it's really severe and depending on the situation, you may get an enema depending on where you are. If you're in the hospital or if you're in the emergency room, it just depends on what your situation is and what your medical provider has determined will be the best thing for you at that point. You could simply have just some inflammation in the tissues or the lymph nodes in your lower abdomen in that right lower side causing pain also. Another reason for pain in the right lower quadrant is a urinary tract infection. We all know what that is, and typically that treatment is pain control and antibiotics, and then follow up as an outpatient for a reevaluation. Sometimes these urinary tract infections, especially in women, if they're not treated quick enough or if they're pretty rapid moving, that infection can actually go up into the kidneys and make the kidneys swell, which causes you to be a lot sicker, causes a lot of pain. A lot of times it goes around to the back, sometimes fevers, and that condition is called pyelonephritis. And that can actually give you pain on the right lower quadrant and also on the left lower quadrant. And you'll also, as I said, typically have pain that radiates around to your back also. That requires pretty heavy duty antibiotics, and sometimes in certain situations you might have to be admitted to the hospital for treatment for that. And again, that was pronounced pyelonephritis. Sometimes someone can have a kidney stone. That's where you have a piece of gravel, essentially a stone, in your kidney, and it drops out into the tube that goes from the kidney to the bladder. That's called the ureter. And as that stone is sliding down, moving, it causes quite a bit of pain and nausea in folks. And so you get nausea medicine, you get fluids, you get pain medicine. And once it's determined what it is, then you get a referral to see a urologist, sometimes in the hospital, depending on how bad it is. Most of the time it's as an outpatient. You go see them in the office after you're discharged home with pain medicine and fluids and a urinary strainer to catch the stone if you pass it. Another condition could be irritable bowel syndrome, or IBS. That's a functional bowel syndrome. It's where your bowels are very spastic and very sensitive and hurt more. And there's different types of that, and it's really up to your medical provider to determine if that's what that is, and then give you the appropriate treatment plan, and then referral most likely to see a gastroenterologist to try to help you manage those symptoms as well. Another condition to hurt in that area is called diverticulitis. This is an infection in your colon. People over time in their large intestine or their colon can have a lot of pressure that causes little outpoochings on the outside of the colon. Those can get infected, and then you need clear liquids and antibiotics to help treat that. As I mentioned in part 2, most commonly people will have that in their left lower quadrant, but you can also have it in your right lower quadrant, which is the area that we're talking about on this video. The next condition is called colitis. That's an inflammation or an infection in your colon. It can be caused by many different things, but in the right side, I would say that one of the most common reasons that you would have colitis, definitely one of the reasons would be something called inflammatory bowel disease or Crohn's disease. It's common to be inflamed in that area from that. So that's called colitis, and more specifically, inflammatory bowel disease or Crohn's disease. And that will require a more extensive treatment plan for you, and most likely definitely a referral to a gastroenterologist to see, so that they can start helping you manage that condition. If you're a female, you can have a cyst on your ovary. It's also called an ovarian cyst. Now, this can actually hurt you on either left or right side, but since we're talking about the right lower quadrant this time, I did want to bring that up. So ovarian cyst, a lot of times your primary care doctors can manage these, or your OB/GYN doctors can manage those as well. A complication of a cyst on your ovary can be that those ovaries will twist, and sometimes they'll twist enough to cut off the blood supply to that ovary, and that is a surgical emergency. That condition causes usually severe pain, and it's called an ovarian torsion, and that is something that a GYN surgeon would need to take care of for you. And that is typically diagnosed by history, physical examination, and definitively by an ultrasound that looks at your cysts on the ovary, and also for blood flow to the ovary through the fallopian tubes. Another cause of pain in the lower abdomen, the right lower quadrant, is a uterine fibroid. These are non-cancerous, benign growths in your uterus, and they can grow pretty big and cause pain in the lower abdomen. And again, the right lower quadrant would be a location that could hurt, depending on how big the uterine fibroid is. If you're a pregnant female, this pain could be coming from something called discomfort of pregnancy. If you're diagnosed with that, it doesn't mean that there's anything in particularly wrong. It just means that you're pregnant and your body is going through a change, and because of that, you're having some discomfort from that. And then the last thing that could be causing pain on my list in the right lower quadrant is if you're a pregnant female and you have what we call a tubal pregnancy or an ectopic pregnancy. That's when the pregnancy ended up in the fallopian tube between the ovary and the uterus, which is not the right place for it to be. That is life-threatening to the mother. It needs to be diagnosed fairly quickly through ultrasound, and then if it's determined that that's what that is, then an emergent referral to an OB/GYN surgeon is placed, and then they determine what the best course of action is for you. Several other factors to consider there as well, and I defer that to the emergency room provider that would be seeing you during that time. Those are conditions that I have seen and come across and learned about that can cause pain in your right lower quadrant, since that's what we're discussing tonight. That is not, I'm sure, all inclusive, but it's probably pretty close. I hope this was helpful to you. I appreciate you watching to the end. Do me a favor, as I always say, leave me a comment. Let me know what your thoughts are on this video. Let me know some things that you might like to hear me talk about emergency room conditions or processes. Let me know if you've had an experience where this information would have helped you. Please don't be specific on names of the hospitals or the staff or your name, but just a general description or a general comment on that. And if you will like and share this video with your family and friends and subscribe to this channel, that would help me out great. And also, there'll be some links above me here. Check out some of the other videos, especially abdominal pain part 1 and part 2. Check those out as well on my channel. And thanks again. Take care.